40 to 70% of kids with ADD usually wind up getting diagnosed within 2 to 3 years of the first diagnosis of the ADD with the oppositional defiant disorder, which is where somebody loses their temper, outright refuses to do things, defiant, always looks to blame others in an argument and will not accept responsibility for their own actions. They're often can be very spiteful, and the other interesting thing about it is they're often highly sensitive to criticism. So while they're being very disrespectful and critical of others around them, they're very sensitive if someone speaks to them in a way they feel isn't fair.
Why such a range, 40 to 70?
Well, these are subjective diagnoses. As you know, in psychology and psychiatry, we don't have a lot of blood tests that tell us what a disorder is, although, again, advances are being made in that direction. Really, it has to do with range and behavior. These are the way these diagnoses are given is we have these manuals, and a child has to have 4 of these 8 symptoms for the last 6 months.
So oppositional defiant disorder, you could say at least half of them probably have ADHD. Now, what about ADHD having oppositional defiant? That's still 50%?
The ADHD kids having the oppositional, or the oppositional child having?
Well, oppositional defiant, we know about half of them have eventually have ADHD. Right. What about the other direction?
It's very similar, very similar. So, of course, these diagnoses overlap.